This is Breakthroughs, a podcast from Northwestern University Feinberg School of Medicine. I'm Erin Spain, Communications Director at Feinberg. The number of American children killed by firearms is rising at an alarming rate. According to the CDC, in 2017 alone, there were more than 500 such deaths, a 50% increase from 2009. A new Northwestern Medicine study published in JAMA Pediatrics has revealed that more stringent negligence laws, which holds adults responsible for safe storage of firearms, may have potential to reduce these fatalities in children. Hooman Azad, a third-year medical student here at Feinberg, is the first author of the study, and he joins me with details. Welcome.
Thank you so much for having me, Erin.
Well, you're a medical student here at Feinberg. I'm wondering, how did you find yourself the first author of the study?
I am doing a master's of public health here along with my MD. And so kind of throughout my experience here, I've been really interested in looking at things that are public health crises. And of course, firearm fatalities and pediatric firearm fatalities specifically are a public health crisis. And, a couple years ago, I went to Dr. Sheehan, who's also a co-author on this study, and I told her that I wanted to do something in pediatric firearm fatalities. And she connected me with a lot of the other co-authors of this study, and we came up with this idea and have been kind of going since then.
Explain what's happening right now with children and firearm deaths in America.
If you look at the number of children who are dying every year, and for the purpose of this study, we define children as anything from 0 to 14 years. So these are, for the most part, not even teenagers. These are young children. And if you look at the number of children dying every year, we have a little bit over 5,000 children dying every year in the United States, and 10% of those are dying from firearms. And, that was a shocking number to hear. I mean, we have greater than 500 kids dying every year. And we had a pretty steady decline from 1990s down to kind of 2009 was the low across the country, when we had only about a half a firearm death per 100,000 children. So that was a pretty significant decrease. And then in the past, say, 10 years, there's been a pretty significant increase in firearm fatalities. We're looking at over a 50% increase since 2009 alone in pediatric firearm deaths.
You decided to look at these deaths and their association with Child Access Prevention Firearm Laws, or CAP laws. Tell me why you decided to look specifically at these laws and how that intersects with this rise in deaths.
When we were looking at firearm deaths and we were trying to figure out, okay, how can we explain why these are happening? How can we explain why there was a decrease? How can we explain why there was an increase? And how can we look at ways to kind of continue that decrease, help prevent preventable deaths? We know that legislation works. We have studies that show that legislation works in kind of adult firearm deaths and pediatric firearm deaths as well. And one of the laws that really hadn't been studied that well in recent times was these CAP laws. The last study to look at them came out in kind of the late 90s, early 2000s, and those laws had not been around for very long at that time. And so we wanted to look at these child access prevention firearm laws and see, is there an association between states that have passed these laws now that we've had these laws in place for a long time? Is there an association between states that have passed these laws and pediatric firearm fatalities in those states?
Okay, so tell me about the laws you looked at for this study. How do they differ from state to state? There is quite a big difference.
Yeah, so there's a really big difference. And kind of just to back up a little bit, 1989 was when the first law of this type was passed, and it was passed in the state of Florida. Since then, from 1999 to 2000, there were 25 states in the United States that passed some form of these laws. So today, still 25 states don't have any form of law. We hypothesized that the laws that would be stronger were the negligence laws. These are the laws that apply to kind of the storage of firearms. And they ask parents, hey, you need to keep your firearms in a safe location. If you have children in the home, you're welcome to have a firearm, but it needs to be in a place where children can't access it. It needs to be out of hands of children. And so those laws, we have a couple of different levels of those laws. And those are the laws that we were really looking at.
And adults can receive jail time with some of these laws, the negligence laws.
Yeah, so there's a huge variety in both enforcement of these laws and in what would happen if these laws were enforced. And so you have everything from a violation with a small fine up to a felony charge in certain states.
You also looked at other types of firearm laws, such as background check and gun license laws that have been shown to be associated with reduced firearm fatalities. You wanted to also just look at those as well, right?
Yeah, absolutely. We were trying to design a study that looked at these laws and these laws specifically. We didn't want to have confounding effects from things like, well, maybe the state just has more firearms and, we wanted to control for that. Or maybe the state just has stronger firearm laws overall, and it's not these laws that are doing it, but just that the state is kind of overall safer. And we wanted to control for that too. And so we selected 3 different laws that have been shown in prior studies to be significantly associated with reduced firearm fatalities. and included those in our study as well.
Okay, so tell me about the study. How did you dive in? How was it conducted?
We got all of our data from the Centers for Disease Control and Prevention. So they keep a log of all of the deaths, and they kind of categorize them by, was it a homicide, was it a suicide, was it unintentional, and what were kind of the circumstances surrounding that death. And so we got all of our fatality deaths from there. And we got our data on the laws from a database called the State Firearm Laws Database that one of the co-authors on this study developed a couple years ago for a different study, which looks at not only this type of law, but it looks at all kinds of laws that different states have that are related to firearm deaths. From there, we looked at when were these laws passed in different states, and we split it kind of into two groups, states that had laws in certain years and states that didn't.
So what are the main findings? What were the big things you found in this study?
I think there were a couple of things that we found that were kind of critically important. And one of the things was we looked at recklessness laws. And these are laws that only apply if an adult hands a firearm to a child and the child then uses that firearm to do something. And so these are laws that we predicted would be relatively weak and wouldn't have a very significant impact. And we found that across the board, there were no situations, there was no even subgroup analysis where these laws were effective. In every situation, it was kind of as if these laws weren't there. There was no association with reduced firearm fatalities. But what was important is when we looked at stronger laws and when we looked at negligence laws, and these are laws that apply to the storage of firearms. These are laws that apply if a child uses, accesses, or could access a firearm stored in a home in a way that's not safe. When we looked at these laws, we saw that across the board there were significant reductions in firearm fatalities. When we look at negligence laws as a whole, we saw a 13% reduction in all firearm fatalities. And looking at homicides, suicides, and unintentional deaths kind of piece by piece, those all had a 12 to 15% reduction in firearm fatalities across the board. And when we looked at the strongest form of those laws, when we looked at what we called the child could access laws, these are laws that apply if a child could potentially access a firearm. They don't have to access it. They don't have to use it. But if it's found that a parent has stored a firearm in a way that a child could access that firearm, they're in violation of this law. And when we looked at those laws, we saw really significant reductions in firearm deaths. And looking specifically at unintentional firearm fatalities, we had a greater than 50% reduction. And this is a small sample size, but these are laws that, are in place in 4 states already, are laws that could be in place in other states.
And what are those 4 states where those most stringent laws are currently?
Yeah, so those 4 states, we're looking at Massachusetts, we're looking at Maryland, we're looking at Minnesota, and we're looking at California.
Tell me about the modeling that you used for this study.
Absolutely. So our main model that we used was we looked at states with firearm laws and states without firearm laws. And we looked at reductions in firearm fatalities between those two groups. But something else that we did is we calculated what's called a population attributable fraction. And this is basically what percentage of the firearm deaths can we attribute to the fact that states had not passed negligence laws. And so we did this both for negligence laws as a whole, and we did this for the strongest form of negligence law. And when we did this for the strongest form of negligence law, again, that's a law that's only present in 4 states right now, we found that, had all 50 states passed that law for the entirety of this study period, 29% of the firearm fatalities that occurred could have been prevented. So basically what we were saying is that of the 13,000 kids who died from firearms in this study period, 3,929 of those deaths could be attributed to the absence of one of these firearm laws. And I think that's a really striking number. We were running different regressions, and as we were doing that, we were like, we want to make sure that this is a robust finding. We want to make sure that this makes sense. And so we looked at non-firearm fatalities as well. We wanted to convince ourselves that it's not just that states that have fewer firearm deaths than children also just have overall fewer deaths. We wanted to make sure that it's not just safer states. And so we looked at non-firearm fatalities, and we really were not seeing the same convincing decrease. Really, the decrease was in firearm fatalities in states that had these laws in effect.
So you noted these deaths, we're talking about all manners of firearm deaths, suicide, unintentional deaths, homicide. And this is one of the first studies that we know of that actually showed a decrease in homicide deaths in children. Now, why was this finding important?
Looking at studies that have been done in the past, they've focused a lot on suicide and unintentional deaths. And the reasons for those are because kind of the hypothesis is that children are accessing these guns and using them accidentally, and that's how these children are dying, or they're using them on purpose to hurt themselves, but that's how these children are dying. And previous studies hadn't looked at homicide deaths or hadn't shown a convincing decrease in homicide deaths. And when you look at these deaths, over 50% of deaths in this age group are from homicide. These children between the ages of 0 and 14 are dying from homicide. They're dying, either intentionally as the result of an argument, or they're dying as crossfire and intimate partner violence, things like that. And so we think it's critically important that we look at these homicide-related deaths in children because it's how more than half of them are dying.
It seems like another study could be done just kind of analyzing this finding.
Yeah, looking back in 2017, there was a study that was done in children under the age of 12. And it found that when these children under the age of 12 are dying, oftentimes they're dying as the result of intimate partner violence. It's intimate partner violence between either their parents or guardians or adults, and they're dying in the crossfire.
How are the majority of adults in the U.S. storing their firearms? What did you find about that?
So when we think about firearm storage in the United States, we know that about a third of homes in the United States that have children in them also have a firearm. And so that exposes about 22 million children in the United States every year to a firearm being in their home. We can dig down further and we can look and see how are these firearms stored. And when we look and see how these firearms are stored, we see that by and away, people are not storing their firearms in the safest manner. We see that only 29% of homes that have any type of firearm in the home are storing it in the safest manner. And the safest manner is when they're unloaded and they're locked away so that children cannot access them. When we dig down a little deeper, we see that actually 4.6 million of these children are in a home that has at least one firearm stored in the least safe manner. And so that's going to be both loaded and unlocked. And so that is a firearm that, a child could very easily access.
Were you able to see what are some of the attitudes maybe out there about locking up weapons? I mean, this is a part of it from state to state, how different people sort of interpret how weapons should be locked up, or they want to have access to them. They want them to be loaded. That plays into this a little bit. There's different attitudes towards firearms.
Yeah, and I think that's a really important point. I think it's important to recognize that a lot of times when people are storing their firearms in what we consider an unsafe manner, they're not doing it because they want their child to access the firearm. They're doing it because they think that it's the best way to protect their home, or they think that it's, for some reason it needs to be more easily accessible. But we know from studies that have been done over and over again, we know that when firearms are stored unsafely, children can and do access them. There was a study done in children under the age of 10, so this is 9-year-olds and below, and found that of children in this study, 71% of them knew where their parents' firearm was, and 36% of them knew where their firearm was and had accessed that firearm. And parents they were not aware. Fewer than half of parents in both situations were aware of these facts.
So we're here in Chicago. There's often headlines about children being caught in crossfire, children dying from firearms. What about in Illinois? Is the Illinois cap law working? And how does Illinois compare with some of the more stringent laws that you looked at?
So our study was really looking at kind of the country level effects. Okay. And so we weren't drilling down into state level effects, but I think it is valuable to notice that Illinois does not have the strongest form of cap law. We have one of the weaker forms of cap laws. We have what we consider kind of the second weakest form of law. And these are the laws that apply that when a child can access a firearm, does access that firearm, and uses that firearm. And so those are a lot of steps that have to happen before this law would apply. States with stronger laws are those that, we see, for example, Massachusetts has the strongest form of law. They have a law that applies if a child could even potentially access a firearm. They don't have to do anything with it. They don't even have to access it. If they could potentially access the firearm, that parent is in violation of this law. And when you look at Massachusetts, over the 25-year study period, they had only 67 firearm fatalities. When you look at Illinois, we had 654. And so, those numbers are staggeringly different. And Massachusetts is a smaller state, but if you look at the rates of firearm fatalities in those states, and you look at it kind of relative to the number of children, Illinois is still much, much higher than Massachusetts.
So we're talking about state to state, because what about laws at the federal level? This really isn't being addressed at the federal level. Is that right?
The majority of laws that are looking at how we can prevent firearm deaths and looking at what should we do with firearms in order to be the safest that we possibly can, those are by and large done at the state level. There are a few federal laws, but things like cap laws, things like safe storage laws, those are all state level laws.
How has this paper been sort of accepted by folks so far out in by policymakers? Has anyone been reacting to this paper yet?
I think it's critically important that policy is informed by research, and policy is informed by things that we know are true. Not by emotions, not by feelings, but by research. And when you look at the studies, when you look at this study, we saw a 13% reduction across the board in firearm fatalities. And that was a reduction that is consistent with prior research and that when we had stronger laws in this study, we had greater than 13% reduction. When we had weaker laws, we had less than 13% reduction. But our role, I think, is to look at the data, look at the laws, and kind of understand what is happening in states with these laws, and is it happening because of these laws?
What's it been like for you personally? You're a third-year medical student to be able to dig into this and publish something here in JAMA Pediatrics on such an important topic.
It's been really, really exciting. I mean, kind of throughout this process, I've had great support from everyone on the team, from Karen Sheehan, from Eric Fliegler, from everyone else on the team. It's just been really supportive and given me a lot of opportunities to learn how to do this research well, and kind of encouraged me to continue doing research about important topics, about topics that are affecting us every day, and about things that, if we understand what's going on and we can say, these laws are working and they're preventing firearm deaths in children, will that change something, and will that kind of lead to a safer world? And our hope is yes.
Well, thank you so much for your work on this. I think that these findings are so interesting, and we're excited to share this with the rest of the medical community.
Yeah, thank you so much for having me, Erin. It's been a pleasure.
Never miss an episode of Breakthroughs. Go to Apple Podcasts or wherever you listen to podcasts and subscribe.